Hi everyone, and welcome to my channel. I'm excited to share my content with you, and I hope you enjoy watching. Don't forget to like, comment, and subscribe to stay updated on my latest videos. Let's get started. In this video we are going to see about: is it possible to experience a stroke without realizing it? Yes. A silent stroke is one that you are fully unaware of or cannot recall having. Stroke symptoms like slurred speech, numbness, or loss of facial or body movement frequently come to mind when we think of them. However, quiet strokes don't manifest these symptoms. Silent strokes, in fact, frequently cause no symptoms at all. Silent strokes, like ischemic strokes, occur when blood flow to a portion of the brain is suddenly interrupted, depriving the brain of oxygen and harming brain cells. However, a silent stroke is difficult to spot by nature. This is due to the fact that a silent stroke affects a region of your brain that doesn't control any obvious activities, such as speaking or moving, so you might not be aware that it happened. The majority of people learn they had a quiet stroke after they get an MRI or CT scan in order to diagnose another problem, and medical professionals detect minor areas of brain damage. Does that imply that they pose a lower threat? The fact that you are unaware that a silent stroke has occurred does not imply that there was little or no damage. Although silent strokes typically only damage a small portion of the brain, the harm accumulates over time. After a number of quiet strokes, you can start experiencing neurological symptoms. For instance, you might start to lose your ability to concentrate or have difficulties remembering things. The American Stroke Association claims that having a silent stroke increases your likelihood of later experiencing a symptomatic stroke. Silent strokes are fairly prevalent, as researchers have long known. According to a 2003 study, 1/3 of adults over 70 have experienced at least one quiet stroke. Multiple silent strokes increase your risk of developing vascular dementia, commonly known as multi-infarct dementia, according to current research. The Cleveland Clinic's medical staff lists the following as signs of multi-infarct dementia: memory challenges, emotional problems, such as inappropriate sobbing or laughing, changes to your gait, becoming lost in familiar surroundings, difficulty making decisions, and losing control of one's bowels and bladder. Other symptoms are so mild that they're frequently confused with aging symptoms, such as difficulties with balance, frequent falls, urine leaks, mood swings, and a reduction in thinking capacity. Can you undo the harm? The persistent harm that oxygen deprivation causes to brain cells cannot be undone. The functions that the damaged sections of your brain once carried out, however, may occasionally be replaced by healthy parts of your brain. If the silent strokes persist, your brain's capacity for adaptation will eventually deteriorate. Can you handle cognitive problems? Rehabilitative therapy can help persons who have lost some of their abilities due to a stroke, according to the National Institute of Neurological Disorders and Stroke trusted source. The following experts can assist you in regaining function: psychologists, sociologists, speech pathologists, physical therapists, and others. Although some clinicians recommend Alzheimer's medications to individuals with vascular dementia, there is still no evidence that these treatments are effective in these cases. If silent strokes have affected your cognitive abilities, there are several simple, doable things you may do to help your memory. To start, try these. Develop routines for carrying out specific duties at specific times of the day. Establish daily routines for placing items you need, such as keys and medication, in the same location. Create lists of tasks and instructions to assist you remember how to complete challenging tasks. To help you remember to take your meds, use a pill box. Set up direct bill payments so you won't have to keep track of due dates. Play games that test your memory to improve. Can silent strokes be avoided? Yes. It turns out that while silent strokes are difficult to diagnose and even more challenging to treat, it's rather simple to prevent them from occurring in the first place. Here are some precautions you may take right away. Manage your blood pressure. According to research, having high blood pressure increases your risk of suffering a quiet stroke. According to a 2011 study, 30 minutes of moderate activity 5 days a week can lower your risk of a silent stroke by up to 40%. Being physically active will also result in better results and fewer stroke consequences than being sedentary. Reduce your salt intake. To lower your blood pressure and lessen your risk of stroke, the American Stroke Association advises reducing your sodium intake. Additionally, it's not simply the salt you add. Foods that are frozen or prepared might contain up to 70% of your daily salt consumption. Take care of your weight. Normal body mass index ranges from 18.5 to 24.9. Your cholesterol should be reduced. Your total cholesterol level should be less than 200 mg per deciliter to lessen your risk of stroke. The optimal level of HDL, good cholesterol, is 60 mg per deciliter or more. LDL, bad cholesterol levels should be less than 100 mg per deciliter. Stop smoking now. Quitting smoking can lower your risk of stroke if you still smoke. Smoking raises the chance of developing heart disease and stroke. Give up the diet beverages. According to a recent study, consuming beverages with artificial sweeteners increases your risk of dementia and stroke. Eat some vegetables. Consume 5 servings or more of fruits and vegetables every day. Keep diabetes in control. A known risk factor for stroke is diabetes. Do I need to see a doctor? Having a stroke is a risky medical condition. Seek quick medical help if you exhibit any stroke-related symptoms. Consult your doctor if you have no signs of a stroke but are at risk for one. They can assist you in creating a strategy for lowering your risk factors and avoiding a stroke. Even though a quiet stroke doesn't cause any obvious symptoms, it can nevertheless harm your brain. Silent strokes occur when the blood supply is cut off to a small portion of the brain, harming the brain cells, much like ordinary ischemic strokes do. Your physical and mental capabilities as well as the health of your brain are all negatively impacted by silent strokes. Your chance of suffering a stroke can be decreased by exercise, good diet, weight management, lowering cholesterol to a goal range, and salt restriction are all recommended. Talk to your doctor about adjustments you could do to prevent silent strokes if you're worried about them. Stroke is the 6th most common cause of mortality in the United States, according to the Centers for Disease Control and Prevention. According to research, men, particularly those who are African American, Native Alaskan, or Native American, are more likely to get a stroke. However, that is only the immediate risk. Men have a significantly lower lifetime risk than women do. Also, men are less likely to pass away following a stroke. Knowing the signs of a stroke can help save lives. Call your local emergency services right away if you believe someone is experiencing a stroke. Every instant matters. Typical stroke signs. Stroke symptoms include confusion, difficulty moving or feeling a body part, difficulty speaking or understanding speech, and a strained expression in both men and women. A person experiencing a stroke could also find it difficult to speak or follow conversations. Stroke symptoms are not specific to men. The 6 most typical stroke symptoms might manifest in various body regions. Eyes. Abrupt vision problems in either one or both eyes. Sudden weakness, numbness, or paralysis in the arms, legs, or face, most commonly on one side of the body. Throwing up or having the urge to be ill in the stomach. Body. General exhaustion or breathing difficulties. Unknown source of an abrupt, intense headache in the head. Abrupt dizziness, difficulty walking, or lack of coordination or balance in the legs. Depending on which part of the brain is injured, the precise symptoms change. Strokes frequently exclusively impact one side of the brain, either the left or the right. In a 2003 study, researchers assessed public knowledge of the 6 most prevalent stroke symptoms. Women performed marginally better than males in their ability to recognize the symptoms of a stroke, according to their poll, but only by a few percentage points. If a person smokes, has high blood pressure, heart disease, atrial fibrillation, or diabetes, their risk of stroke is enhanced. Living in the stroke belt, a group of southeastern states, is another risk factor. That's all for today's video. Thank you for watching, and I hope you enjoyed it. If you did, don't forget to like and leave a comment below. Also, make sure to hit the subscribe button to stay updated on my latest videos. Until next time, take care.